The gentleman from Buffalo, New York, Mr. Higgins, to inquire.
Thank you, Mr. Chairman, for holding this important hearing. As we all know, the country celebrated our frontline workers, especially in healthcare, during the pandemic, but we have not done enough to evaluate frontline work and how those workers have been affected in terms of mental health. And in healthcare, this is a workforce that is overwhelmingly staffed by women, a significant portion of whom are women of color. It is imperative that we invest in the care economy, or the economy of those who care for others, particularly those who are most vulnerable. That's kids and our elderly. Their physical, mental, and financial health matters too, and we should take actions to offer them additional support. For example, I have a bill that would offer nurses and other frontline health workers a $5,000 annual refundable tax credit, in addition to paid leave and the affordable childcare. If we can do more to ensure that the frontline workers are paid the living wages they deserve, we can help reduce at least one potential source of stress and burnout for many families. Ms. Price, can you speak more to how your work as a nurse during the pandemic impacted your physical and mental health? How has having to change jobs to work for a nurse staffing agency affected your financial well-being and the well-being of you and your family? And what trade-offs have you had to make?
Thank you for the question. The trade-offs that I have to make is that I don't have health insurance, so I don't have any benefits. Being an agency worker, it offers me the flexibility, but I don't get paid the same. The pay is not the same. And again, I have to pay out of my pocket for any co-pays for my mother, any co-pays for my son, whom are both on Medicaid for the disabled. So that's the trade-off for me. Yes, I get the flexibility, but I don't have any insurance. I don't have any benefits.
Thank you. On the issue of gun violence, over a month ago, my community in Buffalo, New York, was targeted by a white supremacist who, in only 2 minutes and 3 seconds, killed 10 people and wounded 3 others at the Top supermarket. And just days later, 19 children were killed in a mass shooting in Uvalde, Texas. Last week, my constituent, Zanetta Everhart, testified before the House Oversight Committee about her son, Zaire, who survived the shooting but was shot in the neck. She described having to take time off from work to care for Zaire as he recovers from his injuries. The United States is the only industrialized nation that does not guarantee paid leave. Millions of Americans lack access to health care, especially mental health care. It is unacceptable that not only are we a nation that subjects our people to the constant threat of gun violence, but that we also do not ensure that people receive the support they need to recover from gun violence. And when we entrust others to care for our children, the care should be affordable, accessible, and safe. Our people deserve more. So Ms. Snyder, Ms. Phelps, and Ms. Price, could you talk about what it means to you as parents to know that children's schools and child care facilities are safe?
Seeing the news of Uvalde, I think, shook all of us to our core. And you hear the stories, and weeks later, we still don't feel like it's really real. One mother said, I believe in a hearing, that people will say to her, I can't imagine what you're going through. And her response, as you've seen today, made me cry. She said, if we don't do something soon to secure the safety of our children, you will know what it feels like. And that really hit me because there's so many ways that we as parents are trying to protect our child, to make sure that they have good, healthy food, that they have good schools, that they're getting the experiences and the opportunities to do things that make them a better person, a better citizen. But there's gaps of where we can't help them, where we can't keep them safe. So having safe and affordable schools that we know when we drop our little ones off and they wave, we know that we're going to be able to come back to them and they can tell us the stories about all the pictures that they drew, all the fun that they had, and the imaginary places that they went with their friends that day. Thank you.
For me, the school shooting broke my heart. Right now, I don't have any kids that are in school, but I do have small grandkids. And even as I sit here, I'm sitting here thinking, what can I do to get closer to them so that they don't have to go to school? Because unless the laws change, unless you put something in place, my grandchildren are going to be sitting targets. So the laws must change. It must be raised to 21. You must figure out how you can do background checks so you can check for red flags to see who's getting ready to do what. So I think that until the laws change, the sense of security is completely gone, and it would never be restored until somebody make some positive changes in the gun laws. These are not it.
I agree with Ms. Snyder. I agree with Ms. Snyder and Ms. Price. I've been working, a happily working American since before I was 18 years old, and I've happily paid into our system, and it is not worth it for me in most situations to find a job, if I could anyway, to send my daughter out to school with COVID still rampant, even though people act like it's not, with the shootings the way they are, with everything, it's so dangerous. I want to work. It's probably not worth it for me, for my well-being, for her well-being. And that's a terrible place to be. Like I said, I've been working since before I was 18. I'm happy to work, but it's not worth the trade-off.
Thank you.